Hey there, Mr. Sykes and classmates. Today I'll be talking about my right knee joint model project. I will be talking about the anatomy behind the hinge type synovial joint and demonstrate how it works and functions. So today is my first day of progress, and I've made the four main bones comprising of the knee joint out of clay. I'm showing you this from the anterior view, and these are the four bones: the tibia, the femur, the fibula, and the patella. Now I haven't connected them, as I will be doing so by means of toothpicking or hot glue in the next step, but I can show you a preview now. The fibula would go on the lateral side of the tibia, it would connect on the lateral side of the tibia like this. And the patella would go in the middle of the femur like this. Okay, so today is the second day of progress, and today I've made some of the anatomical markings and I've included some anatomical features like the meniscus. So first we're going to start off with the epicondyle of the femur, and here we have the lateral epicondyle and the medial epicondyle of the femur. Then we also have the epicondyle of the tibia, and once again we have the lateral epicondyle and the medial epicondyle. Down here, we have the tibial tuberosity, which is this green triangle shape. And then we have the tibial crest, which runs down all along this crest of the tibia. Then if we flip this over to the posterior view, we can see that now we have two more condyles of the femur. Except remember, since it's the posterior view and it's flipped, this would now be the medial side and this would be the lateral side. Now if we flip it over again, we can also see that I added the meniscus. The meniscus is a supporting feature and kind of a cushion that acts as a cushion in the knee. And I also added two of these ligaments, which are the ACL and PCL, which I will be talking about further in the video. So on this day, what we did today was the first step I did was I attached the fibula to the tibia. At first I tried using a glue gun, but the clay was not susceptible to hot glue, so what I did, I used a toothpick to attach it. And then what I did was, after that, I'm gonna explain the cruciates. So this one right here is the anterior cruciate ligament, because it's anterior, so that means it's front towards you. And the one in the back, which I don't know if you can see too well, but that's the posterior cruciate ligament, and that's because it's in the back too. And basically the purpose of these two is that it attaches the femur to the tibia, because ligaments attach bone to bone, and it basically just supports both of these bones in total. Then what I did was, first I attached the lateral collateral ligament, which is also known as a fibular collateral ligament, which is this one right here, because it attaches the fibula to the femur. And first, as I said, I tried using hot glue, but that didn't work, so I used these push pins. And then we have the medial collateral ligament, which attaches the femur to the tibia. And once again, I tried using hot glue, but it didn't work, so I used push pins. And basically, what these two do is, once again, it supports the whole structure of the knee together, and it makes sure that it stays solid and stable. And those are the purpose of the ligaments. And lastly, one last thing, I'll flip this over. I also attached the meniscofemoral ligament, which is basically at the back of the femur. Okay, so on this day, what I did was I added the quadriceps, which is the muscle above the knee, and I added the quadriceps tendon, and the tendon is a connective tissue that connects the muscle to the bone, and this basically, the quadriceps tendons connects the quadriceps to the patella. Then I added the patellar tendon, which is actually a ligament, and the patellar tendon, what it does, or the patellar ligament to say, connects the tibia to the patella, and this is the green thing. And as I mentioned before, I used push pins because hot glue didn't work. And then I also added articular cartilage, which is right here. And the purpose of the articular cartilage is to keep joint motion fluid, so it basically lubricates these bones and it acts as cushions. Now you may be wondering what's the difference between the meniscus and the articular cartilage. Well, the meniscus mainly act as shock absorbers and help stabilize the knee, while the cartilage's job is more to cushion the knee, but also lubricate the bones. And what I also did, in addition to that, if we flip this over very gently, basically what happened was I changed this and I moved it so that was closer to the medial meniscus now, since it's on the posterior view, for the meniscofemoris ligament. So yeah. So here we have the full functionality test of my knee model joint. As you can see, it behaves like a hinge synovial joint because it moves in one direction and has very limited movement in other planes, as I will show. So for the knee, the main direction that it uses, or the bones can go in, is flexion and extension. As you can see, it flexes here and it extends here. I can show it from the back too. It flexes here, extends here. Oh wait, flexes here, extends here. Then we can also see that in my model, it moves very minimally to a minimum degree laterally and medially. Has very minimum lateral and medial rotation. And this shows how and why my knee joint model is fully functional as a hinge synovial joint, which is the type of joint our right knee is. Flexion, extension, flexion, extension. You can also see this from the back. Flexion, extension, flexion, extension. Medial and lateral rotation.